Thank you so much, your amazing panelists. Now, ladies and gentlemen, we're going to explore how integrating world-class healthcare technologies with exceptional hospitality is redefining the patient experience. Now, please welcome to the stage Dr. Marwan Al-Kaabi, CEO of Sheikh Shakhbout Medical City, Christian Schuhmacher, Executive Chairman of the Emirates Hospital Group, Dr. Mohaymen Abdelghany, CEO of Fakeeh University Hospital, Hesham Abdalla, CEO of MPC Healthcare, and your moderator, Ahmed Faiyaz, Partner for Healthcare and Lifesciences at PwC Middle East.
Thank you. Good afternoon, everyone. Good afternoon to my panel and all of you who've made it out here to this very interesting panel discussion and sessions on health and wellness tourism. Gentlemen, coming over to you very quickly, Dr. Marwan. What do you see, Dr. Marwan, as the ingredients of combining technology, innovation, integrating care, and developing a sustainable health tourism destination? What kind of investments have you seen happen that are shaping this in the right direction for UAE?
Thank you for having me this beautiful day at the panel. I think if we look at the medical tourism index, they usually tackle three main aspects, which is the first one is the destination environment, and that includes the destination establishment as a destination for tourists and visitors and so on. There is no doubt that UAE has become a very attractive destination for both visitors and tourists from not just the region, around the globe. The other aspect is the medical tourism industry, and then for this one you need a collaborative approach between the provider and the regulator. And the regulator will need to make sure there is an infrastructure there, the regulations, laws that support medical tourism. The provider will obviously need to provide the quality of care, that's one thing, but also we need to tackle affordability, accessibility, and patient experience. And for all those, technology is a big enabler. So without that, you would not be able to either reach there in time or not to the best outcome that you would like to see. And for us in UAE in general and Abu Dhabi, we're very lucky with having a regulator that is forward-thinking and always supportive to those new initiatives and support the growth of providers in terms of attaining and using the new technologies. The other thing is also the infrastructure is well established. And for us in SSMC as a provider, we've been managed to actually ensure that our patient experience get the outcome and the quality clinical outcome that they would usually travel for. But also, nothing, most of it's working, right?
That's sure. Can you give him yours?
Okay, that's better. So we've been able to make sure that the outcome, the clinical outcome is up to their expectation, but we are very keen on providing the patient experience that our patient would like to see in addition to the clinical care that usually they travel for. So for any of this, technology is a big enabler. And the investment that has happened over the years in providing and using the technology in improving the quality of care and outcome, in getting the patient experience to the level that we'd like, and meeting the expectation of our patient has helped us reach where we are now. We are the best. Abu Dhabi and Dubai have been ranked the best in the region for the medical tourism, and in addition to the infrastructure and other things I just mentioned before.
Thank you, Dr. Marwan. Fully agree with you and echo your thoughts. I think you spoke about a very forward-thinking regulator, investments by the private sector, and use of advanced technology to further build and grow health tourism. I want to come over to you, Christian. Christian, you've led a very established, leading healthcare provider, which is anchored in a healthcare city-like environment, and you continue to lead another organization, also established in a similar environment. How does that ecosystem help you shape and grow and attract health tourism? What kind of opportunities do you see to integrate with the hospitality and travel sector, which we know that UAE is one of the best in the world in?
Thank you, Ahmed. And I think Dubai Healthcare City is actually the nucleus of what we're discussing here on this conference, bringing people from different parts of the industry, from acute care to medical wellness to tourism together. Dubai Healthcare City has been doing that for a long, long time, and this is kind of the nucleus of at least the Dubai ecosystem, how successful that can be made. And I think, like you just said, we need a lot of ingredients to make it successful, to make medical tourism and make the UAE as the continuous number one in the region successful. That includes the obvious ones like hospitality that we have the pleasure of having in Healthcare City. It includes obviously world-class providers. And if you look at the density of world-class providers in Healthcare City alone, that is exactly what Sharif said in the opening session, is like how the private players are working together here in Dubai. Lastly, surely in Healthcare City, as a proof of concept, so to speak, that this cluster effect is actually working, is all the teaching and research facilities that are there with Mohammed bin Rashid University, Al Jalila Foundation. So it's actually kind of the testing ground for the wider ecosystem, and I think it's a very successful proof of concept.
Thank you. Thank you, Christian. Dr. Mohaymen, I want to come over to you. Like Christian, you've been an integral part of leading health organizations in Dubai and really supporting and encouraging health tourism for as many years as I know you. I want to come over to you and ask your perspective, especially on the academic side. Clearly, it's extremely important when you look at destinations that have built successful health tourism propositions, or a perception that this destination is known for health tourism. Usually high quality clinical education is a part of it. Continuing medical education is a part of it. How is that shaping up in Dubai, and what are some of the initiatives that can further successfully build that growth and build those opportunities? If you can talk to me a little bit about that on the education side, but also, to echo what Christian was talking about, the integration with the travel hospitality side of the business to create that patient experience.
First, thank you very much for having me with this esteemed colleagues. The evolution of the healthcare ecosystem in the UAE, and if we want to focus more on Dubai, has been very rapid. And the system has matured very well now. And if I look at it like 10 years back, many of the patients were seeking treatment abroad. Now the trust in the whole system has grown, and we can see that the outbound patients who are going seeking treatment outside is decreasing year after year. And the reason is we have these establishments, these government establishments, these private establishments that have taken healthcare to the next level. And big part of that is now maturing into the next phase. And the next wave is to come up with academic care models, which builds another layer of growth, another layer of trust, another layer of confidence in the systems that do deliver healthcare. It's not a healthcare delivery system in isolation of education, in isolation of research. For example, in Fakeeh, we do this teaching hospital so that we can teach, train, and develop the talents for the future, in addition to starting research. So this is more sustainable, this is more attractive, this is also very important for retention of the talents. You want to bring talents from everywhere in the world, and you want to retain the talents to continue here. So you have to provide high-quality healthcare provision with education and research. So this triad is the next wave that the whole UAE healthcare ecosystem is moving toward. And we see it very clearly with the likes of Cleveland, SMCC, King's, Fakeeh. These are institutions which look at advancing this more of an academic care model, which not focus only on provision, but also focus on education and research. So I think it's a very good sign of a movement in the right direction.
Thank you, Dr. Mohaymen. Can't help but agree with you. Um, Look, we spoke about a strong center of excellence model which focuses on integrated care. With Christian, we covered the importance of integrating across that care ecosystem, uh, using a hub and spoke approach, using tie-ups and partnerships with hospitality. Dr. Mohaymen talked to us about the importance of academics and academia, medical education, because we've got a war for talent. We've got huge clinical shortages across the world. And those who build that successfully can then create that attraction for health tourism. I want to go over to you, Hesham. I think let's bring in technology now and talk to us about how traditional providers, your traditional brick and mortar providers, how can they do more? Dr. Mohaymen mentioned some names. These are all very credible, very well-known names in healthcare who are also transforming, who are also adopting to the change that healthcare systems are going through. But how can they embed AI, telehealth, machine learning models, and other clinical decision support systems? What do you see as the future for that, and what more can be done to imbibe that, adopt that, and build us to the next stage?
First, thank you very much for giving us this opportunity. And I believe this is translate the visions when we have the public, when we have the private, when we have the regulators with us. This is translate the vision of the country that it is one unit, because I believe such big initiative will not be achieved alone. It needs all the efforts to achieve the vision of the country of UAE. And UAE become an attractive point in general, either for tourism, and if you see the numbers for medical tourism, it's growing year over year, especially in certain areas here in this country. And I believe also specialization is one of the key. We can find Sheikh Shakhbout very specialized in oncology. We have other STEM centers. There is a lot of things that it was not there before. AI played a big role here because it will make the time short. In the meantime, efficiency will be better. Also, the quality of all this effort should be more efficient. One of the example is digital platform that linking the local provider with the international payer. Will make the life of the people that they are planning to come here is more easy and more concise. Would like to have, for example, another portal that enable the patients from either countries with different language that they can access their files, their lab, their diagnostic, their indications. At least will help them also with different language to have a better, efficient way. Telehealth and telemedications, nowadays it become part of our reality. Part of that is cost efficiency, going to the patients while he's sitting at home. For that, it's giving more compliance and more comfortable time for the patients. And it's not only for just follow-up, pre-assessment for the patients before coming for such medical tourism, and also after operations or after assessment to ensure the follow-up and ensure the result I believe it's part of the key activities that should be here in this country. Collaboration between all the providers, especially the private, it's key for the success, because in the private market you can find one hospital, they are very specialized in certain area, other hospital, they are specialized in others. Some diagnostic can be affordable for one centers, other no. For that, I believe it's not a competitive market, more than collaborative market at this stage.
Fully agree with you. Thank you for those observations. Look, I think telehealth can play a very important part, particularly in the pre-care and aftercare services. So let's say a patient comes from abroad, gets treatment at SSMC or Emirates Hospital or Fakeeh Hospital. The engagement with the patient to give them that seamless experience, to diagnose them properly, and then to follow up and provide aftercare services and stay connected to make sure that their care is coordinated effectively could be a big role, as you mentioned, that telehealth can play. I want to come over to you, Dr. Marwan. Talk to us a little bit about the Center of Excellence model. We recognize that now we have centers of excellence in the UAE, and Hesham touched upon that a little bit. You have hospitals that specialize and build institutes of excellence. How does that model play in, and how are models like that using technology and data to further integrate and provide seamless care to patients?
So having center of excellence or institutes, if you like, actually has been helping us over the years to consolidate many of the services under one managed unit, making sure that all the services required to that service is provided to the level and timely with the same professionalism that you would expect. So the Department of Health for a long time now, for a few years, they've been assigning Center of Excellence to make sure that this center is able to provide the level of care quality-wise, the outcomes and KPIs are met. At the same time, they also support to the research, education through that center to that service or department, if you like. The other thing we have been taking in SSMC is establishing institutes. For example, we have an institute for neuroscience that helped us bring neurology, neurosurgery, and intervention neurology, pediatric and adult, both under one leadership, under one unit. So they provide the service to our patients seamlessly, and then they also provide the level of care. Any new advanced medication can be provided in that department, in addition to the oncology and women and children. Also, there is the flagship services. We identified there are certain, we've got certain expert and leading physicians in certain specialties, like memory clinic, like IBD, like menopause in women and children, and many others. We've identified them as flagship services. And for their services, we are supporting them to grow and provide and be accessible to patients who need that service, with a team who understand them in full. They understand them not just clinically, but also understand the challenges they go through, what support they need. They connect them to the right supporting agencies, and so on. So this model has really helped us provide that level of care and outcome we would hope for our patients.
Thank you, Dr. Marwan. Christian, I want to come over to you. You've had long years of experience in Switzerland, a destination that we all know as a world-class medical services destination, but also one with exceptional or exclusive hospitality services. There are other destinations doing a lot of business in health tourism as well. Thailand is one of them. Germany is another, again, focusing, as Dr. Marwan said, on those centers of excellence or institutes of excellence. What can Dubai do differently? Or what can UAE do differently? I think you've got Abu Dhabi and Dubai with leading hospitals, very established names, and doctors now from different parts of the world that we didn't see 10 years ago. So what's the differentiation moving forward for the UAE?
Yeah, I think other than all five of us wouldn't prefer to sit on a Swiss mountain right now and watching some snow and not sweating to death. That's the obvious one, but it's not. Switzerland, Germany, Thailand. They also play on the scenery, on the nature and all of that. However, we as UAE obviously have the prime advantage of our location. We are attractive to patients from parts of the world that have not easy access to healthcare, to advanced healthcare. So already that is all established. I think what the next step for us here in the UAE has to be to compete with the top leading medical tourism destinations is exactly what Mohaymen and the colleagues have referred. We need to include more on the research side, on the academia, on the teaching side. Not only will that build further on the trust of our patients, but it's also attracting talent. A doctor who is also affiliated with the teaching university, like it is already the case with Dr. Marwan at SKMC and others, obviously Fakeeh and others. That is a very, very attractive proposition for talent to come here. Not only doctors, but healthcare professionals in general. Then the second piece is probably integrating the whole patient pathway a little bit further. I mean, we have a panel here of esteemed colleagues, mainly from the acute care sector. We're going to hear about other parts of the healthcare journey later on. And I think this Congress, this venue, this occasion is a great proof of example that actually we need to widen the services offered holistically to our patients and not pure acute healthcare. So talent attraction through academia and research, and enhancing and widening the patient pathway and patient services.
Thank you, Christian. I really like how you articulated that. I think some key takeaways from that. You emphasized the importance of connectivity and diversity that we've got here to be able to attract patients, the importance to invest more in academia and research to attract the right talent. I want to go over to Dr. Mohaymen and Hesham with a quick question that both of you can answer from different perspectives. Gentlemen, when we looked at medical tourism, as we call it, a decade ago, it was more about who's traveling for what types of services. Those were usually acute surgeries or acute episodes, life-saving, life-threatening diseases and conditions. Not to say that they don't travel for that today. In some countries it's reduced, some countries it continues to rise. It depends on the challenges that they have in their own health system, and perhaps affordability weighs in and plays a role as well. But when we look at the theme of this event, the theme of this event is travel and heal. So travel and heal, travel and rejuvenate, travel and unwind. Now playing into that theme and going across the ecosystem, which is much broader and more holistic, how do you see that new world shaping up from a UAE perspective? And what are the different trends? What are some of the innovations that you anticipate to see or take shape? Talking from your perspective, Dr. Mohaymen, and then I'll come over to you from a more technology perspective.
There is always the healthcare component of medical tourism is a medical service at the end. And the healthcare component, as we discussed earlier, across all sectors, it's maturing, whether it's in acute care, whether it's in wellness, whether it's in cosmetics, whether it's in dental, and several others. It's maturing, yes. The thing that we need to also consider in maturing this, it's not an only healthcare system. There is an ecosystem that works around it. There is hospitality sector, hotels, airports, visa arrangements. There is a big ecosystem that works around. And if we want to continue to be patient-centered, we need to consider all these factors. Not only the healthcare component. It's great to have an excellent healthcare system, but that is not enough for a medical traveler. Medical travelers is looking at the entire experience for him or her and their families as well. So I think this needs to be tightened more. We have all the infrastructure. Emirates and Etihad are traveling to more than 150 destinations in the globe. Hotels like Burj Al Arab and amenities, the number of hotel rooms, the number of hotel apartments between Dubai and Abu Dhabi is great. I mean, the infrastructure, transportation, and all these elements need to come together to provide an ecosystem for a medical traveler to be competing with other medical travel destinations. And the main strength of that is that the healthcare itself is now becoming at a very high level. So it's now the time to connect all the remaining dots and arrive at a very high aspiration. And the likes of DXH, the Dubai Health Experience, it's providing this on its platform, so you can book and you can get insured and you can get followed up through a single platform which provides you the experience. We need to see more and more of this and advancing.
Absolutely. Hesham, maybe some words from you to wrap it up.
Yeah, I'll agree with Dr. Mohaymen, and I would like to refer to Dr. Kaabi about what he said, that UAE is attractive destination. The attraction didn't come from the air. It comes because it is top-down strategy, top-down from the presidents of this country, president of this country, till the executors on the ground. And this is what makes it successful. Like what he said, the infrastructure, the security, the innovations, what you pay, you get. In many countries, what you pay, it's lost. For that here, the service that you are paying, you are getting against that. For that, this is, I believe, key for the success stories to be built for the medical tourism in general. Many other aspects that it needs really to be considered, like adoption of latest technology, because the people that they are traveling here, they like to have latest technology with easy access, which is not available in their countries. They need to have a queues, they need to have a lot of waiting lists. However, here, the access that we see in the government on the private for such patients is quite really enticing, I can say. for that one stop. It's very important for the patients to come and shop for everything. In the meantime, also regulations need to be given some importance, like patient privacy, data privacy. All this it's a question mark for many of the countries. For that, we need to consider such things. But at the end, I see Emirates, this is one of the most top countries. They have a good appetite and a good soil for medical tourism, and the base is there. We have the people that's traveling, but just slight modification. I'm sure UAE, with all the visions of our president, to be number one of the number one in worldwide, inshallah.
Thank you. Thank you, everyone. Thank you to my esteemed panel for joining us on a toasty afternoon. Have a wonderful weekend, and look with a forward-thinking, progressive regulators who really want to support, drive, build these partnerships between public and private sector, but also with other sectors like tourism and hospitality. And the capabilities that we have, we do believe that the future is bright for Dubai. Thank you. And the UAE.
Thank you very much.
يا ابني رأفت والله ليه كده ليه كده ليه كده